So you've decided to go ahead with methotrexate treatment. Let's go through a list of practicalities.
Okay. Do I need any tests before I start?
Yes, you'll have several blood tests before you begin at baseline. We're checking really on the health of your liver, your kidneys, your bone marrow, making sure you've not got an underlying infection, things like HIV or infectious hepatitis.
And are there anything, what practically do I have to think about taking the pills?
So the methotrexate's taken once a week. So you can pick the day that you start on. It's convenient for you. The actual tablets themselves are small. They're 2.5 milligram sized. And people will vary a bit with a starting dose. It's often 10 milligrams once a week. Sometimes it's 15 milligrams once a week that you start on, depending on your doctor. So if you're starting on, for example, on 10 milligrams once a week, that's 4 2.5 milligram tablets. If it's 15 milligrams once a week, that's 6 2.5 milligram tablets. And then also you'll be taking as well folic acid, which protects you against some of the liver issues, and it also can help the nausea issues if you get them. People will vary on how many folic acids they give you to start with, but it's quite common to be given it every other day apart from your methotrexate day. Some people do it once per week. But that'll all be on the package information when you actually pick up the drug.
Okay. And one thing that's bothering me, you said that feeling queasy is one of the more common side effects. So if I'm feeling nauseous, what do I do to deal with that?
If it's very minor, it's quite possible it does get better with each methotrexate dose over each week. If it's significant, there's several things that you could do. First of all, if you're on a lower dose of folic acid, at your first visit, we would put the dose of folic acid up, and that often does help the nausea a little bit. Bear in mind as well that most people are not going to get significant nausea. The other thing you might try is it's a once a week drug. Say you take the methotrexate at bedtime, then that avoids you feeling any nausea during the waking hours. If in the tiny number of people who might get more significant nausea, you could ask your GP or us to prescribe an antiemetic, so a tablet's going to minimise sickness.
Okay.
One other thing about that, but this is really for people who've been on methotrexate for a while, sometimes we convert the methotrexate from oral to injectable, which is actually quite an easy thing for patients to do themselves, a bit like being a diabetic. And people who inject their own methotrexate are much less likely to get nausea.
Okay. And how often do I have to come for follow-up visits or for blood tests?
So once we've got the methotrexate working and your skin disease has settled down by as much as we want it to, then the blood tests only need to be done every 3 months. In the first few months, however, when we're trying to get things sorted out, we often do the blood tests more frequently. So a standard thing to do would be to do a blood test 2 weeks after you start, and then one at 4 weeks after you start. And usually we will see people a bit more often during the first few months to get the dosing right and to talk about any minor side effects that you might have. So I would see people, for example, between 6 and 8 weeks into treatment, though people will vary a bit when those initial visits are.
Okay, and if I do get an infection while I'm taking methotrexate, what do I do?
So standard infections that we all commonly get, things like a bad cold, flu, COVID these days, you would simply miss your methotrexate out for a week or two until you felt that you'd fully recovered. If you did have anything that was more worrying, bad chest infection, that kind of thing, it would make sense to actually see your doctor, to have a slightly lower threshold to see your doctor. But you always should stop the methotrexate. But when you're on an immune suppressing drug, if the infection's severe, it may need some extra blood tests or for you to be checked over medically.
Okay, so you just mentioned COVID. Are there any issues between vaccinations and methotrexate?
So it's absolutely fine to have most routine vaccinations, which are non-live vaccines, while you're on methotrexate. There isn't a problem with that. And we recommend that everybody has, for example, flu vaccine every year when they're on methotrexate. So that's something that you need to sort out with your family doctor. In terms of COVID vaccines, we also now recommend that you should have had those. If you're in a situation now when you're wanting to start methotrexate, but for example, you've never had a COVID vaccination, never had a flu vaccination, there is a little bit of sense in getting the vaccinations done first and then waiting, say, a couple of weeks after you've had them and then starting the methotrexate. Because although it's not proven, it's possible that being on the methotrexate means you don't respond quite as strongly to a vaccine as you should do.
And will the methotrexate interact with any other medicines that I might be taking?
So it is very important that at the first visit with your dermatologist, you go through all the medicines that you're on, because yes, certain drugs can interact with methotrexate, though the vast majority of things don't interact. Similarly, if another doctor, your GP, is prescribing you a drug for something, they need to know that you're on methotrexate before they decide to do it, and they need to check that there's no interaction there. Most drugs, though, are fine. The couple to know about are things like high-dose penicillin. So if you did have an infection, when you would be stopping the methotrexate anyway, sometimes that can interact with methotrexate. And the other important one are anti-inflammatories, not really things like brufen, but stronger ones like naproxen. There is sometimes an issue with taking those on methotrexate, and you should make a decision whether you stay on methotrexate if you needed a course of a high-dose anti-inflammatory.
Okay. And if I did have any problems and I really needed to, how could I get in touch with you?
It'll all depend on the doctor that you're consulting with. But the general advice is, if you have any minor problems, you just wait until your next follow-up visit. But if there are any significant problems, we would like you to get in touch with us. We'll all give you different ways of getting in touch, but make sure that you clarify that with your doctor at your first visit. Some of us might give, for example, secretary's phone number or an email. There are some nurses that prescribe methotrexate that work with us that may have a slightly different mechanism, but that will be clarified with you at the first visit.
Okay, thanks very much.